I am fairly certain that you have heard of the proverb, physician heal thyself. It's been around for literally thousands of years. It was already hundreds of years old when it appeared in the Bible. The message is a criticism of hypocrisy. It is an instruction to work on your own defects before you try fixing the defects that you find in others. That is not what I'm talking about today, although it sounds very similar. Today's lesson came to mind when I was pretending to listen to my oncologist. I admit to tuning out. There is only so much cancer information you can absorb at one time. I caught myself thinking, this guy seems nice, but his job must be rough, having to inform people day after day that they or their loved one has cancer. I wonder what he says when he gets home, when his wife asks him, "How was your day today, honey?" Okay, so maybe that's a weird thing to think about, but I've never pretended to be normal. When my daughter was just a little girl, she pointed out that normal was just a setting on the dryer. Anyway, I could imagine him saying something like, "It was okay, I guess, but I had to tell a lot of people that they were likely going to die." Then I thought, what if the doctor could add one thing to his daily response? But there was this one guy. You'll never believe what he did. And there it was. My new objective. I was going to be that one guy. And my mission was clear. Patient, heal thy physician. This change in perspective had an almost immediate effect. I did not dread the daily trips to the hospital to endure yet another miserable procedure designed to save my life. Instead, I was looking forward to my next visit. I was busy planning what I could do next to make people laugh, to send them home with a story about that one guy. And the best news of all is that rectal cancer provides you with a seemingly inexhaustible source of second-grader approved potty humor. You just have to be crazy enough to use it. For example, when someone inevitably asked what kind of cancer I had, I was ready with the following bit of naughtiness. It turns out that I'm not actually paranoid. There really is an a-hole trying to kill me. It just happens to be my own. Radiation treatment was another gold mine for humor. To the scientifically trained technicians operating the radiation equipment, I would remind them of Enrico Fermi, who created the first nuclear reactor in 1942. It was called Chicago Pile 1. I would then tell them to avoid the little boys' room for a little while, as I recently made my own nuclear pile. During this process, I discovered temporary tattoo paper. You can use it with an inkjet printer to create whatever non-permanent tattoo you want. Imagine the possibilities. I assure you I did. When you are undergoing targeted radiation treatment, they give you real tattoos to assist them when lining up their giant ray gun. My first use of the temporary tattoo paper was to print a classic Looney Tunes picture of Marvin the Martian, pointing his uranium Pu-36 explosive space modulator at one of these tattoo marks. I just waited for the technicians to find it on their own. The whole time they were laughing, I was imagining the stories. You'll never believe what this one guy did today. There was another time when I printed a warning sign. I put the fake tattoo just above my tailbone. It read, "Caution, hot tushy," with all the O's replaced with radiation hazard symbols. I wore my kilt for one treatment, for easier access to the target. During my chemo infusions, I referred to the chemists that made my personal infusion cocktails as bartenders. I would wear the most outrageous things while sitting in the chair for hours receiving the infusions. I would try to make the other patients laugh, or at least smile. At one visit, a patient's daughter insisted that I read her mother's blog. In it, she wrote of her fear of the first day of chemotherapy. She was worried that she would be stuck in a room with a bunch of depressed people for hours. She wrote of her surprise finding this one guy, dressed as a Wild West sheriff. Boots, vest, badge and hat and all. Receiving treatment and making patients and the staff laugh. On my last day of chemo, may it forever be my last day, I wore a formal Scottish kilt with Prince Charlie jacket and top hat. I spoke all day in my best Scottish brogue, pretending to be thoroughly outraged at all the pink in this cancer wing. "These breasties are getting all the attention," I complained out loud. "It's about time us colorectal patients formed a movement," I would demand with enthusiasm, hoping that people would notice the double entendre. All the while I was carrying a bouquet of brown, heart-shaped helium balloons, just daring someone to make a comment, and when they inevitably did, I pretended to be even more indignant. "I suppose that you think these should be pink hearts or something." At this point I would complain that the balloon bouquet people royally messed up, that they had made them upside down. I would grab one of the brown heart-shaped balloons, turn them upside down very dramatically, and point out that it was supposed to be a brown fanny, the symbol of our movement. Yes, I succeeded in my mission. I was that one guy. And I still am. More than 2 years later. When I show up at the hospital, the people at the coffee service still know my order by heart. The other day, I returned to the chemo ward with a bunch of flowers from a farmer's market. I said that these flowers were homeless and that the chemo ward might be able to find proper homes for this little bit of springtime. As I was leaving the chemo ward, I overheard a veteran nurse pointing me out to a newbie. "That's the one guy that I was telling you about. That one that gave us the bouquet of brown fanny balloons." If you want personalized medical attention in this age of seemingly indifferent HMOs, try being that one guy. Patient, heal thy physician. You might just find out that you've healed the entire medical center. Thank you for listening.